I think before we can answer what is occupational therapy, we need to first answer an equally important question, which is what are occupations? And really occupations are the things that everybody wants and needs to do, that have meaning and value to their lives, that fill their time. Those are the things that really matter when you get down to it. So those are what we think of when we think about occupations. So then when we think about what is occupational therapy, or what does an occupational therapist do? An occupational therapist is basically somebody who incorporates your meaningful and valuable everyday activities into the therapeutic process. So if you're, for example, a farmer and you have a stroke and you have trouble moving, say, your right side of the body, the occupational therapist is going to talk to you about, well, what do you do in your everyday life as a farmer? What kind of equipment do you run? What kind of animals might you need to take care of? And they're going to use that knowledge and they're going to incorporate aspects of the occupational farming into the therapeutic process, taking the things that are meaningful and valuable to you and then using those things as therapy. So the primary role of an occupational therapist is to help you live life to its fullest. Our role is to help you perform and participate in a way that you want to. Sometimes folks have problems because they can physically perform their occupations, but they may not be able to participate in life the way that they want to. Everybody. I would say that on some level, at some point in our lives, most of us could benefit from occupational therapy. And what really limits people is just the lack of awareness of everything that we can do. One of the interesting things about occupational therapy is that we work with people across the lifespan. An occupational therapist might work with a premature infant on how they suckle off a bottle and how they coordinate that swallow-breathe reflex. And then you go all the way through the life course. OTs work a lot with children, especially in the school system, working on age-normative skills like how to hold scissors, how to write. They can work with young adults on how to transition from high school to college. Any time in your life where you need to learn a new skill set or participate in life in a new way. And then, of course, the things that we think of typically with middle-aged and older adults, illness, injury, surgery, disability. But then at the end of life, occupational therapy is incredibly important because when you strip away everything else, what's left at the end of the life is your ability to do things you want and need to do. Somebody might go into a hospital and see an occupational therapist and a physical therapist treating the same client, and it might look very similar. The biggest difference between occupational therapy and any other healthcare profession is we're the only ones that have this focus on occupation and activity, and it shows up in our training. So an occupational therapist receives training in anatomy and physiology and neuroanatomy, but they also receive in-depth training in activity analysis. Because you and I could have the same injury, but if you want to get back to work as an accountant, and my favorite hobby is being a blacksmith, then the occupational therapist has to be able to work with both of us. And then when you think about the thousands of activities and occupations that people could want to engage in, you have to ask the question, well, how can an occupational therapist ever help all these people with these diverse interests? And it's really because they receive that in-depth training and activity analysis that you simply don't see in any other profession. What you can do is really just limited by your imagination. If you want to work with kids, you can work with kids. If you want to work with infants, you can do that. If you want to work in a hospital, you can do that. If you want to work out in the community, you can do that. So you should never get bored in this profession. When I think about what's the most amazing thing that I've seen an OT do, it's really difficult for me to pick one because there are a million examples. And I think what makes that more difficult is, for one person, being able to return to work was really amazing because the treatment approach was amazing and the OT was so creative. For others, it might be helping somebody with severe Parkinson's and a tremor find a way to feed themselves without the tremor causing the food to fly out of their spoon. And in that latter example, that may have caused that person to break down and weep the first time they were able to do that successfully. So the thing about occupations is it's all very relative. Because the littlest thing, being able to brush your teeth, do your own monthly budget after you've had a brain injury, go back to driving your car, can be immensely important in ways that you or I could never think of because we take it for granted because we can do it. So it's really difficult to say what's the most amazing thing an OT has done, because in any of those examples I just gave, those people would tell you that was the most amazing thing that they've ever done. So you have a national need for occupational therapists, but you also have regional needs, and the need is great here in the Pacific Northwest, in particular in Washington State and Central Washington. We simply do not have enough therapists per capita. We are actually below therapists per capita when you compare us to the rest of the country. So there's a great opportunity if you're interested in becoming an occupational therapist. The job prospects are better than most professions.